The three biggest concerns that patients have coming into a dental practice are time, money, and fear. A lot of patients think from time perspective that to get dental implants, it could take a year or two to get that done, and they're surprised to find that either a single implant or a full arch of implants can take 4 to 6 months or less to get the final result. The procedure itself is a single day, and it usually takes a few hours. So depending on the person and what we're doing, if we're doing the whole mouth or just the upper or just the lower, we're usually doing the procedure in 2 to 3 hours, and then we'll have the patient there an additional couple of hours to build their new set of teeth. So we put in a really nice fabricated set of teeth that day so you don't leave the office without any teeth. For a single implant procedure, because of all the planning and design work with the 3D imaging and fabricating a surgical guide, we can place the implant in 15 minutes, and the total visit might be 30 to 45 minutes long. So if we're looking at money, I usually talk about the investment that a person's going to make. And what's really nice about what we do is everything's all in one house. And so someone isn't having to go around to a few different professionals, a few different doctors to get their work done. So we can streamline the timeline, and that helps keep costs down. I tell people, it is an investment. It's kind of like buying a nice car and parking it in your mouth. And so just like a car, there are companies that will do healthcare financing where you can pay things off over 5, 7, even 10 years. So they're really good about finding the level of payment that a person can afford. So if a patient sees the value in investing in their health by fixing their mouth, then usually there's a way that they can make it affordable. Fear aspect, that's one of the big things in dentistry. I mean, it's one of the realities of what we do. And when we're dealing with people with dental implants, they're missing teeth or a tooth. There's a lot of trauma there. There's a lot of emotion. So we can see people with a lot of anxiety and fear. So we really make it a point. It's important to really align with that person and help ease their fears. There is a solution. There is something we can do. So it starts with just meaningful conversation. Then it leads into, let's make sure you're comfortable so you don't have to worry about it. So for a person to stay comfortable, we have multiple forms of sedation, from oral sedation to having a dental anesthesiologist come in and really make sure that that patient is comfortable, because that's paramount to the success. When you have people with this high fear, high anxiety, and you take care of them, either with sedation at first and then through just good service and being gentle, then what'll happen over some subsequent visits, they'll realize, actually, I enjoy coming here. I enjoy seeing you guys because I'm not worked up or anxious about coming to the dentist anymore. So that's a really cool kind of byproduct of what we see happen. If you have any more concerns, please contact us at New Smile Now. We'll take good care of you.